Let's have a conversation about what happens when a patient puts their hands on you at work. It's never okay. Work in the operating room. So all of my patients are actually having anesthesia. They're not functioning correctly after you have anesthesia. We're going to fast forward to the end. I'm standing next to him as we're done. They're taking down the drapes. We're getting ready to go out to the recovery room, and the patient is awake. 80-year-old-ish gentleman having a minor procedure, which means he did not need to have general anesthesia. That was where I came in, waiting for them to finish putting on the final dressing so that we can go to the recovery room. And let's pretend like this is my badge. And he reaches over and he grabs my badge, pulls it to him to read it closer because his head was right here. To let me just remind myself of your name. Really didn't think anything of, because he just kind of grabbed my badge and pulled it to him. Badge holder. Kind of let it not snap back. He kind of placed it back. But then before he moved his hand, he did one of these. Little brush. It wasn't a grope, it was just a brush. What was my reaction supposed to be? But did he know what he was doing? I looked down and he looked up at me and went, okay. This is not something that's reportable because the guy has had anesthesia, but that little wink let me know that he knew exactly what he was doing. I just ignored it. I just kind of kept moving along. I did not acknowledge it. It took a little bit for me not to laugh because I thought, how brazen. The reason for this post, the reaction that this story got amongst coworkers, nurses, medical personnel, people who are older than the current Me Too movement, thought this was a hysterical story. People over the age of 40 were crying when they hear this story. They're laughing. They're like, oh my God, girl, it shows that you still got it. God, I'm so embarrassed. Anybody under the age of 40, a very different reaction. Oh, ew. I don't let them put their hands on me. I didn't let him put his hands on me. He just did this little brush. I ignored it. I didn't make a big deal about it. The reaction of people who were under the age of 40 to my reaction to it actually was what I found a little interesting. People will push the limits. Younger nurses out there, younger meaning new into the profession, not chronologically young, but maybe chronologically, maybe. I'm over the age of 50. I've been a nurse for 34 years. Kind of seen it all. I've done it all. I've been witness to it all, participated in it all. Nothing surprises me. I wasn't really offended by this. I thought, wow, this guy... Would it be different if the guy was like a 38-year-old? Would that have been something that would have made me go oh my God, the guy was 80. I know I'm putting this out there. People are going to put their hands on you. What can you do? Somebody is in intensive care, in the ER, the post-operative care unit. They've had anesthesia in the psychiatric ward, and they physically put their hands on you. But you know that they're not in their right mind. Is there a case for that? No. First of all, I would not complain about it. This was somebody I will never see again. Okay, the guy's 80 years old. I wouldn't say anything about this. But would you? And who would you complain to? Nursing a long time, and it takes a lot for me to be like, wow, that guy. But it was the reactions of other people that I thought was really even more interesting. It's not that people were offended. People were not happy that I thought it was funny. That's what it is. I did think it was funny. Oh, I don't know. Sometimes the world needs to lighten up a bit. But anyway, it's not okay. I'm not condoning it. It certainly is not okay. What are you gonna do? What was I supposed to do with this guy who was 80, gave me a little brush? He's an 80-year-old guy that came from a different time. He's a whole generation ahead of me. Very disrespectful. Younger men today, please learn that this is not acceptable behavior. And don't do it. Don't start it now. Don't do it when you're 80. But how much of this comes with the territory of being a nurse?